In this module, we will talk about women in the labor force with a focus on the unique workplace hazards that they may face. So it is recognized that there are gender disparities when it comes to wages, with men earning more than women, and while some women are underrepresented in select occupations compared to men, such as construction and agriculture, women are still overrepresented in other workforce populations. For example, there are more female teachers and childcare providers, as well as in other service sector jobs, like in the healthcare field and in the beauty industry, which includes professions like being a hairdresser or nail technician. In fact, in the United States alone, it is estimated that there are over 600,000 hairdressers and that over 90% of this workforce consists of females, many of which are of reproductive age. So, because women are overrepresented in select jobs, they also face different workplace health hazards compared to men. According to the National Institutes of Occupational Safety and Health, or NIOSH, women generally have more work-related cases of musculoskeletal disorders, respiratory diseases, infectious diseases, and anxiety and stress disorders. It is also important to note that many women in the workforce are also women of reproductive age and often work during pregnancy and even while nursing, which are vulnerable periods not only for women but also children. In fact, it is estimated that over 70% of working women are of reproductive age, and while workplace exposures can affect both male and female reproduction, issues related to reproduction and pregnancy are of particular concern to women, which we will discuss in greater depth after discussing other workplace hazards that disproportionately impact women in the workforce. So one workplace hazard that may disproportionately impact women is workplace violence. Workplace violence is defined as any act or threat of physical violence, harassment, intimidation, or other threatening, disruptive behavior that can occur at the worksite. It ranges from threats and verbal abuse to physical assaults and even homicide. It can affect and involve workers and others depending on the work setting. For example, in a healthcare setting or a service sector job, it could also impact clients and customers. In the United States, the Occupational Safety and Health Administration, or OSHA, reports that nearly 2 million workers suffer from workplace violence each year. And according to the National Institutes of Occupational Safety and Health, or NIOSH, workplace violence is the second leading cause of injury-related death for women in the workplace. It is also estimated that nearly 2 out of 5 workplace homicides are perpetrated by a relative, with almost all being a current or former spouse or domestic partner. According to the U.S. Bureau of Labor Statistics, in 2019 alone, close to 21,000 workers in the private industry experienced trauma from non-fatal workplace violence that also required days away from work. And of those victims who experienced trauma from workplace violence, close to 70% were female. It is also important to note that workplace violence is usually underreported. So there are 3 types of categories or types of workplace violence that may occur, including internal violence, which occurs between employees of an organization, external violence, which is perpetrated by strangers outside of the organization, for example, a robbery of a convenience store, and client-initiated violence, which occurs between workers and customers or clients, such as workplace violence in the healthcare setting. In the healthcare setting, for example, all 3 categories of violence may occur, but client-initiated violence is the most frequent and can occur among nurses, nurse aides, and psychiatric aides. It is also important to note that consequences of workplace violence are costly on many levels and can result in financial losses, as well as decreased quality of services, including decreased quality of patient care in healthcare settings, low staff morale, in addition to increased absenteeism or missing work, and impacts on mental health among those impacted both directly and indirectly. Now, another workplace hazard that disproportionately impacts women is ergonomic hazards. Ergonomics refers to the study of factors likely to affect interactions between an individual and their working environment, and ergonomic stressors involve heavy lifting, repetitive motion, and awkward postures and motions. Now, compared to men, women generally have more work-related cases of musculoskeletal disorders, which may impact several parts of the body, such as muscles, nerves, tendons, and others. Researchers suggest that the higher prevalence of musculoskeletal disorders, seen among women compared to men, may be ascribed to several risk factors, including biomechanical, physiological, psychological, and other factors. For example, depending on the given work task, women may experience a higher level of repetitive movements, physical strain, and postural stress, which may increase their risk of musculoskeletal disorders. It is also important to note that certain ergonomic hazards are either created or exacerbated by pregnancy. For example, pregnancy can affect reach distance, balance and lifting tasks, and aggravate the effects of repetitive motions. Some research also suggests that there is a link between certain ergonomic stressors and adverse pregnancy outcomes, such as spontaneous abortion, preterm delivery, and low birth weight. Several studies have reported an increased risk of preterm delivery among women whose jobs involve a combination of ergonomic stressors, such as standing for long periods, repetitive lifting, and working for long hours. Moreover, poor ergonomic practices often exaggerate existing discomfort, resulting in increased rates of work absenteeism, sick leave, and a lack of motivation among pregnant workers. So, appropriate accommodations are key to enhance the comfort of pregnant employees and help them handle work-related stress, as well as the innate physical challenges that may be associated with pregnancy. Another workplace hazard that may pose additional risks to women has to do with stress and workplace organization. It is documented that the levels of stress-related illnesses are nearly twice as high for women compared to men. This is of concern as job stress has been linked with heart disease, muscle and bone disorders, depression, burnout, and other chronic diseases. Moreover, balancing work and family tasks can put additional stress on women. Women often take primary responsibility for caregiving, and when family and work demands collide, the resulting stress can lead to both physical and mental health problems. Additionally, women are more likely than men to do contingent, part-time, temporary, or contract work, and compared to workers in traditional job arrangements, contingent workers have lower incomes and fewer benefits. Women who work in insecure jobs or lower-paying jobs may fear that bringing up a safety issue could result in job loss or more difficult work situations. They may also be less likely to report a work-related injury. Another thing to consider is that workplaces and personal protective equipment, or PPE, is often designed for the average-sized male, placing women's health and safety at risk. The protective function of personal protective equipment, or PPE, such as respirators, gloves, work boots, or other protective equipment, may be reduced when they do not fit properly. In healthcare settings, for example, one study reported that masks, goggles, and gowns are often too large, resulting in gaps in protection, tripping hazards, and impaired movement, and that poorly fitting masks cause cuts and sores. Additionally, women working in hot climates report that PPE causes overheating, fainting, or dehydration. This can be of concern given that climate change is also increasing globally and will have a major impact on worker populations working in extreme temperature environments.